Take it off or leave it on? What? I was told I look like I'm wearing a neck brace if I just leave it right here. Brief. Um, uh, Very briefly, I want to thank all of you for joining us this morning. Thank my friend and colleague, Councilman Howard Duvall, and all of our wonderful staff and team members for joining us as well. We're here today so I can do the thing I never wanted to do as a child and get a shot. Going to get our flu shot this morning. Obviously, we are still very much in the midst of the greatest pandemic this country has seen for the last 100 years. I'd be remiss if I didn't say that as Americans, we pray for the President, the First Lady, and every single soul that has been affected by this incredible virus, for the hundreds of thousands lost in America and millions across the world, and all. We keep them in our prayers. Today, obviously recognizing the significant challenge of the pandemic, it really underscores even more so the importance of getting your flu shot. Every year, we make sure that we step up and highlight this as an important opportunity for every Colombian. Uh, uh, just yesterday, again with the pandemic, DHEC reported another 229 new confirmed cases, 20 deaths in our state. We know that it's important for folks to get their flu shots, especially if you have other underlying medical conditions, also known as comorbidities, like asthma, heart disease, and diabetes. High-risk individuals, including um, uh, uh, anyone who has any of these chronic conditions, regardless if you're young, certainly for pregnant women and young children, and those of us who may be over 65 years of age. Your risk of heart attack goes up 6 times higher if you get the flu. We want to thank our partners, Doctors Care, for coming out to administer these vaccinations. Doctors Care is currently giving flu shots at any of their locations. You don't even need an appointment. And even if you don't have any chronic conditions or any special risk factors for flu, it's still important to protect yourself, protect your family, and your community by getting your flu shot this year. So I want to encourage everyone within the sound of my voice, step up. Let's take on this double threat that faces our community, this country, and indeed the world right now. And suck it up. Let's go get the shot. So I'd be happy to answer any questions before I go and get my needle. I am trying to delay it. I'm filling up time, so I appreciate that. My children went for their checkup the other day, and apparently while they were there, an 8-year-old got loose and literally ran out of the building.
Especially the people who maybe had not been taking this seriously before.
Well, obviously, is this working?
Nah, think it might have got bumped off.
We've been very serious indeed since we called for our very first Midlands Coronavirus Task Force meeting the last week of February, and we met on March 6th, the day actually that on that day there were no confirmed cases of COVID-19 in South Carolina. Had our first diagnosed case that evening, and we've been diligent, blazing a trail with the leadership of Mr. Duval and our colleagues. Almost every decision we've made as a city and as a council has been unanimous in doing every single thing we could do to try and slow down the threat. The mandatory mask ordinance, early on curfews, shutting down the economy, which is something that we did not want to do but felt necessary. We stepped very quickly a Resilient Columbia economic recovery plan to support small businesses and address some of the needs around food insecurity, and supporting our critical nonprofits, supporting our public safety officers as well, and what turned out to be an over $6 million plan. We're in football season. We remain convinced that as it looks, we're still about halftime on addressing this pandemic. We are nowhere near done. And this is a pandemic that does not affect Democrats and Republicans and independents. Politics has no place here. This is a legitimate public health threat to any and every living being, and we need to treat it with the level of gravity that it deserves, and find some way to cancel out the noise. And that's why we've been unrepentant about the fact that we follow data, we follow science, we follow good public health advice, and we'll continue to do so. even in the midst of political concerns. If, in fact, we get our arms around the public health crisis, we will address the economic crisis. If we get our arms around the economic crisis and others, then our kids can go back to school. We can get back to some degree of normalcy that our families deserve. That's our focus. That's our focus. Address the public health threat, and the economic and educational challenges will address themselves. And we're not going to slow down because we believe that our responsibility is to protect the health, life, and safety of Colombians. And our one true north is the preservation of human life. And that's our focus. We're not turning back. Is it right, brother? All right. Yeah. You know, I'm a mayor. We're elected officials, so by definition, we're optimists, okay? So some of the interventions, the MPIs that we engage in, can actually help us as we approach flu season this year. So wear your mask. Just wear your mask. You'd be amazed at how it might help us all, maybe even depress the flu season this year. But yes, the double threat of COVID-19, which is devastated the world with the seasonal flu, can put people in a very bad and deadly situation. And we have a number of different health threats, long-term, consistent health threats in South Carolina that we've not done a great job as a state addressing. We have hundreds of thousands of people who don't have access to quality health care. We've not expanded Medicaid in South Carolina. So all those comorbidities, all those challenges around obesity and diabetes and heart disease and hypertension and risk for stroke and all those things, they add up into what can be a deadly cocktail. And it's important for us to do the things that we can do, to use our podium, to use our bully pulpit as leaders in the public sector that hopefully enjoy some degree of public trust, to encourage people to do this one small thing. It hurts for a millisecond, maybe, and we can indeed save lives. We can see more birthdays. We can celebrate more Thanksgivings and Halloweens and Christmases together as a family. One great silver lining of these last several months is for my family, and I think many families, is we've had so much more quality time together. And I think hopefully that underscores for everyone the importance of making sure that we take care of this one temple that God gives each and every one of us. We take care of it, and we'll get more time together. So that's our call. Let's step up, let's stand out, and let's get our flu shots this year. All right? Thank y'all.